ones that we can modify, and the World Health Organization has published the fact that in their estimation, 80% of heart problems can be prevented by lifestyle changes and environmental changes. And the main modifiable risk factors are smoking, nutrition, obesity, diet, high blood pressure, and alcohol.
Hello and welcome to the latest Golf News vodcast series, Heart Matters, in association with King's College Hospital London in Dubai. I'm Lachlan Kitchen, and it's great to have you along for this series where we'll dive into some engaging and informative conversations all about the heart. Throughout this journey, we're going to be joined by the leading doctors and physicians from King's College Hospital London in Dubai for some honest, open discussions all about the latest research, the trends, and the developments in cardiovascular health. In this first episode of the series called Heart of the Matter, we'll take a closer look at what truly lies at the heart of your health. We'll explore a wide range of conditions that fall under heart disease and how they can impact your life, sometimes in ways that you might not even realize. From high blood pressure to cholesterol to smoking, poor diet, and family history, we'll break down the major risk factors. And we'll also discover how some small but consistent lifestyle changes paired with proactive medical care can go a long way in both preventing and managing heart disease. Joining me today on this very first episode is Dr. Masood Khan, the consultant interventional cardiologist at King's College Hospital London in Dubai. Dr. Khan has returned to Dubai after many years, having finished his schooling here. He was the first student from Dubai College to study at the University of Cambridge. He subsequently undertook cardiac training in the UK and was a leading consultant cardiologist in London for nearly 2 decades, moving to Dubai earlier this year. His colleagues in the UK have given regular feedback, including the title, which sometimes he's not too happy about, the best cardiologist in London. Dr. Masood Khan, thank you very much for joining us and being here on the first episode of Heart Matters.
Thank you, Lachlan. Thank you for that introduction. It's a great pleasure being here.
Yeah, it's great to hear from your experience, obviously being the best cardiologist in the UK, which is something I know you do brush off, but it wouldn't come from your peers, certainly without warrant.
Well, it's very kind of somebody to have said that. It's... You and I were talking about this earlier. Nobody knows who the best cardiologist is anywhere. I had very many excellent colleagues in London and elsewhere and here.
Well, it's a pleasure to have you here. So we'll start with some of the simple ones. To begin with, people talk about heart disease. But could you explain simply what are the key conditions that fall under that umbrella of heart disease?
So there are a very large number of conditions, but in broad terms, I'd probably put them under 5 categories. Maybe I'm just going to quickly talk about what the heart does before I talk about the way things can go wrong. So the heart is essentially a bag of muscle in the center of the chest. And this bag relaxes to fill with blood and it squeezes. And every time there's a heartbeat, it relaxes and it squeezes and it relaxes and it squeezes. And it pumps blood containing oxygen and nutrition around the heart. But the heart, because it is a very active organ, needs oxygen and nutrition itself. So it has these blood vessels that sit usually on the outside of the heart that supply blood and oxygen to the heart. So the conditions that cause heart problems, those blood vessels that sit on the outside of the heart and supply blood to the heart, they can get plaque formation, cholesterol deposits that can cause blockages in the blood vessels, which can lead to conditions like angina and heart attacks if a blood vessel gets blocked, which then means that the heart itself is being starved of oxygen. There can be problems with the heart rhythm. It's meant to relax and squeeze regularly, but there can be difficulties with the heart beating too slow, too fast, irregularly. So rhythm difficulties. There can be problems with heart valves. The chambers inside the heart have one-way valves. There are generally 4 one-way valves within the heart, which open and close to make sure that when the heart squeezes, the blood goes in the right direction. So you can have problems with the heart valves. Congenital problems. People can be born with heart difficulties. And then actually problems with the heart muscle itself that can cause weakness of the heart.
There's a range of conditions there, some of which, as you said, they're born with. We will discuss that in future episodes. Children that are born with a hole in the heart, and there's obviously genetic issues when it comes to heart disease, and those build up of the plaque that you said, and also the calcium build-ups and those deposits. But when you look at some of the main causes, Doctor, or perhaps rather than main causes, we often refer to them as risk factors. What do you see some of those main causes or risk factors behind these issues?
So it's a long list, and I'm probably going to leave out one or two, but not intentionally. I tend to divide the risks into those that we can modify and which to some extent are under our control, and those that we can't modify. The ones that we can modify, and the World Health Organization has published the fact that in their estimation, 80% of heart problems can be prevented by lifestyle changes and environmental changes. And the main modifiable risk factors, this won't surprise anybody by the list I'm about to mention, are smoking, nutrition, obesity, diet, high blood pressure, alcohol. I've probably missed out one or two things that we may mention as we go along. Non-modifiable risk factors include family history, genes, age. Unfortunately, cardiac conditions become more common as you get older. Ethnicity, things you can't change. So you can't change that. But even if you have one of those risk factors, you can make a difference to your risk of heart disease with a healthy lifestyle.
Yeah, I think 80% is certainly much higher than we're often thought. That's a huge amount, but also there's a positive there that so much of it is preventable.
Absolutely.
Doctor, when you look at some of those factors or those conditions which aren't controllable, you mentioned ethnicity or genes.
Yep.
Can you go into detail about some of those, please?
So ethnicity, there does seem to be a preponderance in certain ethnicities, which is a function of their genes, to certain cardiac conditions. So people from South Asia, from the Indian subcontinent, seem to have a greater risk of developing diabetes and coronary artery disease. People of African origin seemed to more likely to develop high blood pressure, and their hearts adversely respond to high blood pressure more quickly than people of other ethnicities. There are, for example, some Hawaiian Islanders, for example, or Pacific Islanders, not just Hawaii. Diabetes, obesity seems to occur more easily, and as a consequence, all the complications associated with those conditions.
Yeah, because we often talk about needing to know your family history.
Yeah.
And that's, I guess, a further extension, looking at those genetics and going back into certain...
Family history is more than that. You can have what may be considered a lower risk ethnicity, but then have specific genetic abnormalities in somebody with a lower risk ethnicity that, let's say, puts them at risk of very high cholesterol. And if you have this condition called familial hypercholesterolemia, then people have sky-high cholesterol levels and a very high risk of coronary disease.
So, Doctor, just touching on two of those points, high blood pressure and high cholesterol, unfortunately, they're very common. And how do they contribute to the conditions of heart disease?
They are very common. If I start with high blood pressure, so a publication in The Lancet just a few years ago, they looked at leading causes of early death worldwide and discovered that high blood pressure is the biggest cause of premature death worldwide. It's known as a silent killer because people often don't know they have high blood pressure unless you actually check it. So it's something that should be checked regularly. When people do have high blood pressure, it puts increased stress on the blood vessels because this is the pressure inside the arteries, the blood vessels that carry blood around the body. That leads to plaque and cholesterol buildup inside the arteries. It leads to increased stress on the heart and can reduce the pumping efficiency of the heart. And the combination of high blood pressure and high cholesterol, but even high cholesterol without high blood pressure, can further lead to blockages in the blood vessel, plaque formation. Cholesterol gets deposited inside the arteries and causes narrowing blockages of the blood vessels, which then limits blood flow and oxygen to whichever part of the body that oxygen was meant to be supplying blood to. And unfortunately, there seem to be certain arteries which are more susceptible to this plaque formation. Those supplying the heart, those supplying the brain, those supplying the legs, which can then lead to heart attacks, strokes, pain in the muscles of the legs, depending on the blood vessel affected.
Yeah, which reiterates the points about prevention and getting screened as early as possible. Some of those other factors, smoking and poor diet, how do they directly impact heart health?
Smoking. there is no safe form of tobacco. I wanted to say this now. I see a lot of patients who come and tell me that, do you smoke? No, but I don't want to use a brand name, but, they're using heated tobacco or they're vaping. There is no safe form of tobacco use. And this is not just me saying this. Again, this is the World Health Organization. This is other organizations. How does it do it? Smoking increases the risk, makes the blood more sticky, more risk of blood clots forming inside the heart. It damages the inner lining of the arteries. It causes inflammation, which again causes deposition of cholesterol and plaque formation in the arteries. People who smoke have higher levels of a poisonous gas called carbon monoxide in their blood, which means that their oxygen levels are lower. I'm not even scratching at the surface of the ways that smoking causes problems. There is no safe form of smoking.
Aside from smoking, and we know a poor diet, obviously, and a poor diet, but that really comes in line with a sedentary lifestyle often, doesn't it?
They often go together because people often have, if they're more health conscious, then often they make various changes, including diet and lifestyle and sedentary. A poor diet, processed food, increases inflammation in the body. And inflammation, as I was just saying earlier, can cause damage to the inside of the arteries. A poor diet means that often people have less nutrition, essential elements, vitamins, etc., that can't reverse heart disease, but certainly are important. High calorie, low nutrient fruit foods just make you put on weight. You just turn that into fat. And then fat itself causes inflammation. Fat makes exercise more difficult. And it's often sort of a vicious feedback where, you start off with a poor lifestyle and things just get worse and worse and worse because you then become able to do less and less.
It's a poor cycle to get in. And one of those other factors, you did speak upon genetics, but the significance of family history. What does the research say about how that can increase someone's risk for heart disease?
It depends on the condition. There are certain conditions where it, slightly increases the risk. If, let's say, people have a general family history of heart problems, especially at a young age, and I'm talking about coronary disease and things like that.
So what would you define as a young age?
So, for example, we have these risk calculators that we use to estimate an individual's risk of a heart attack or stroke. In those risk calculators, a heart attack or angina or stroke below the age of 60 is defined as a younger age, because these things become more common as people get older, sadly. So in people like that, the risk of developing a similar condition is probably 2 to 4 times the risk of the general population. But there are certain specific conditions. I mentioned familial hypercholesterolemia earlier. That is something that is inherited, in the technical term is autosomal dominant, which means that if a parent has familial hypercholesterolemia, each one of their children has a 1 in 2 chance of having the same condition. So there are certain conditions, other cardiac conditions as well, which are inherited in that way, which means that if your parent or your sibling has the condition, you have a 1 in 2 chance, a 50% chance of having the same condition.
And when we look at all of the conditions with heart disease, and we want to try and be able to prevent some of them, and I'm sure you've already mentioned these before, what do you see are the main lifestyle changes that people listening or watching today can do to make a big difference to improve their heart health?
One of the biggest is exercise. And if somebody is not exercising, even if they start with just a gentle walk regularly, the difficulty with not exercising is that the less exercise you do, the less you become able to do. And if you have become very deconditioned, then just start with a gentle walk. It's hot, it's summer in Dubai right now. Nobody wants to go outside. But, there is this mallathon going on in the malls. Go to a mall, go to somewhere that's a little bit cooler. If you want to start with just a short walk, but gradually build it up, because for cardiac health, exercise needs to be, ideally, should be some aerobic exercise, cardiac exercise. That's why it's called cardiac exercise, meaning that you need to get your heart rate up. So yes, resistance training is also generally good, but for cardiac health, there needs to be some cardiac aerobic exercise in there. So one of the biggest things is exercise. Second, diet. We've touched on this briefly, but generally trying to aim for what's what's considered one of the healthiest diets is what's known as the Mediterranean diet, meaning more fresh fruit, more vegetables, more pulses. And people sometimes ask me, what is a pulse? So, lentils, peas, beans, chickpeas, that sort of thing. Fish, as long as it's not sort of deep fried and, grilled fish, avoiding red meat, avoiding dairy products. Nuts are very good. And I'm not saying, I tend to tell my patients that, you can't avoid these things 100%.
It's the balance.
It's the balance. And the things that often we all enjoy eating need to be considered a treat rather than part of our daily intake. So we talked about exercise, we talked about diet, cigarette smoking, obviously, any form of tobacco use, monitoring your health, monitoring your weight. Many people are aware of something called a body mass index, which relates your weight to your height. People can easily, there are online calculators to calculate.
There's scales that can do BMI. They're very available.
Scales will do it for you. But, if you don't have one of those scales, as long as you know your height and your weight, you just put it into an online calculator. It'll tell you whether you have a healthy weight or not.
But doctor, I mean, we've heard all these things for generations about a balanced diet and about exercise. But you hear the medical fraternity is still needing to preach these. Why do you think sometimes the message isn't getting through with people?
Because it's very easy. You actually have to make an effort, unfortunately, these days to have a healthy lifestyle. So I'll give you an example. A colleague of mine in the UK looked at there's a large Sikh community in the west of London. And this colleague looked at the Sikh community in West London, the urban Sikh community in Punjab in India, and the rural Sikh community. So genetically the same people. And he found that the Sikh community, the rural Sikh community, had yes, they had more infections and things like that. But in terms of heart disease, they were slim, they exercised more, their diets were not high in fat, they had low cholesterol, they had very little heart disease. The same people moved to urban centers in India. They developed a sedentary lifestyle, poor eating habits, they put on weight, diabetes, more heart disease. And then some of them moved to West London and it got even worse. So, and as I was saying earlier, 80% of heart disease is preventable. So this was just a really clear example of that. So, and it's not that, the people who are moving to urban centers with these lifestyles, they're not doing it deliberately. It's just that our urban, if you like, Western lifestyle is not conducive to a healthy lifestyle. And you actually need to make an effort to go out and exercise, to not spend all your time sitting in a chair like we are now. I go around the malls in Dubai, every second shop is trying to sell me a cream cake. It's actually more difficult to find...
To hunt down the fresh
fruit. To hunt down the fresh
yeah?
fruit and the vegetables. It's much easier just to find something sweet and, when you're feeling a bit peckish.
Yeah, I had a doctor who told me once, don't buy your food where you buy your petrol. And because it's so easy. We're inundated with these fast movable goods that are laden with artificial products.
And you can now, you get on your phone, it'll be at your door in 15 minutes.
It's the convenience that's the challenge. For people that are perhaps concerned about their heart health, what's your advice on getting screened? Or how often should you get screenings or when should you start?
That's a very good question. And actually, as we've touched on the fact that things are preventable, I think people need to take a bit of responsibility for their own health. I think everybody over the age of 20 should probably at least once have their cholesterol checked. Because if your cholesterol's fine, then I'm not saying you must come back at that age regularly. But we know that these problems start early. Autopsy studies have shown in young people in their 20s, let's say people who've died of motorcycle accidents and things like that, that the process has already started in their arteries at that age. So it's not that this starts in middle age, it starts decades earlier. And if you can prevent it early, then you reduce the risk of it just getting to the point where it's causing problems in middle and older age.
And I'm guessing you also have a baseline measurement as well.
Yeah, so I would suggest that people in their 20s should have a baseline measurement of blood tests, diabetes, etc. If they have a family history, it may be something that needs to be repeated more often. If everything is fine in your 20s, I'm certainly not suggesting this is something that you need to come back and have every year, once every 3, 4, 5 years. Certainly if you have a family history, a genetic preponderance, then more frequently. As you get older, I would suggest that once people have got to the age of 40, then this is something that needs to be looked at more regularly. Blood pressure measurements. I personally think we should all have a blood pressure machine at home.
Okay, so on that, what sort of screenings? I mean, should we having? Is it blood tests, blood pressure, stress tests? What are the screenings that are available?
So I think there are a whole series of those. The obvious ones, the simple ones, are blood pressure, which you can do at home.
Oh, really?
Yeah, a blood pressure machine costs I've checked in the UAE, you can get a perfectly reasonable blood pressure machine with a cuff that goes on your upper arm. I don't believe the ones with the cuffs that go on the wrist.
Okay, so it's the upper arm we want.
Cuff that goes on the upper arm. You can buy one for 100 dirhams. And,
has the pump and...
No. You put the cuff on your arm, you press a button,
Oh, wow.
30 seconds later, there's a digital display and it's giving you your blood pressure. It's very simple to use. I ask all my patients to get a blood pressure machine, and you don't need to be obsessive about it. I don't suggesting that you must be checking it every week, but if your blood pressure is normal, a couple of times a year is enough just to make sure that it is okay. So blood pressure you can do at home. Blood tests, again, you look in the newspapers, there are offers for blood tests all the time. If you've had a blood test, you're young and everything is normal, you probably don't need to repeat it for a few years. If there are abnormalities, then you should probably go and talk to somebody about them. The blood tests should include a check for diabetes, should include a check for cholesterol, which are in terms of blood tests, the main cardiac conditions that we're looking for. Stress tests are things that I would, we see people coming along at a young age wanting stress tests. I'm not sure those are useful when people are in their 20s. As they get older, then potentially, and certainly if they have a family history, if they have other cardiac, if they have other risk factors, then it's something that may be worth doing in 30s, 40s and older. One other form of screening is something called a CT scan. So CT scans are slightly controversial. CT scans involve radiation, and they certainly aren't something that we should be doing to people who are younger. But once people get, in my opinion, over the age of about 40, 50, a CT scan will tell you if there is early plaque in your arteries. Whereas these other tests, a stress test, etc., will only be abnormal if you've already got severe blockages.
And if someone does find early plaque, is it of immediate concern, or is it something that you'll just want to monitor with your physician?
No, well, the thing is, if you've got early plaque, that means that this process has started in your arteries and it will get worse unless something is done to slow it or prevent it progressing. And so having seen that early plaque, we've now recognized that there is a problem, and then we need to talk to that individual about what we can do to reduce their risk. Because if the plaque formation has started and you don't change the risk factors within your body that have caused it to start, it's going to progress.
Yeah, it's just going to snowball.
Early plaque doesn't cause symptoms, doesn't make people feel unwell, but it's a marker that that person is at increased risk of problems in the future, and we should be probably a little bit more aggressive about trying to control their risk factors to prevent those future problems.
We spoke about genetics, but does heart disease affect women differently? Are there different factors that women need to keep in mind as opposed to men?
There are some. I mean, it's clearly some of these things we've talked about are common risk factors. But certainly, there are different hormonal changes in women. There are pregnancy-related cardiac conditions that clearly only occur in women. Menopausal changes. Premenopausal women tend to have a lower cardiac risk than men, but postmenopausal women develop heart disease with greater frequency. And, heart disease is the leading cause of death in women as well as men. There is actually a lot of evidence that often the symptoms that women get are slightly different to the symptoms that men get, and the textbook all seem to be written based on the symptoms that men describe. But the classical central chest pain as a symptom of a heart attack, women often don't actually get that. They might just present with breathlessness. They get back pain. And as a consequence, there are lots of studies showing that actually women often get delayed treatment, later treatment. Their heart problems often aren't recognized as early as those in men. So it's something that we, as medical professionals, need to be conscious of. And women also need to be conscious of the fact that just because they are women, unfortunately, they're not completely protected from heart
Well, if
problems.
you speak to my mother, she's too busy worrying about the men in the house to get them checked because they never want to go to the doctor.
No, yeah.
Sometimes they'll forget to get themselves tested. For someone who might have recently been diagnosed with a condition, or perhaps they've got some risk factors, how can they best manage their condition? What's your advice?
I mean, a little bit of that depends on on the condition. Clearly, a lot can be done about the heart. So a heart problem shouldn't be something that people should get depressed about. We have many treatments to reduce risk and to treat conditions once they have occurred. Remaining active. People often think that, they now have a heart condition, that now they must take it easy. That is not true. People should not treat and should not be treated as an invalid when they have heart problems. There are very few cardiac conditions that are not helped by keeping active and actually exercising regularly. But certainly people who, general advice is difficult because it is going to depend on specific conditions.
Well, let's talk about exercise.
Yeah.
You hear things about the 10,000 steps a day or the heart rate. Well, what's your best general advice you can give someone about exercise for maintaining a healthy heart?
So I don't think we need to be fixed on this 10,000 figure. Some people may have seen that there was a lot of publicity just a couple of months ago that a study had come out saying 6,000 steps is enough. I don't think we need to worry about particular steps, but you need to keep active, and you need to, if all you're going to do is walk, that's fine, but do it regularly. Do it 3, 4, 5 times a week for at least 20 minutes. And I normally tell my patients at a pace that gets your heart rate up, gets you a little puffy. You don't want to be sprinting because you're not going to manage 20 to 30 minutes if you're going really fast. But a speed that you can maintain for 20 minutes. As the more you do it, that speed, that distance will become faster and increase. But you've just got to start at the pace that's comfortable for you.
On the topic of stress, stress is part of everyone's life. Everyone you meet, especially in Dubai, they're stressed about something else. But how does stress overall affect everything from, I guess, mental health to heart health?
So, in the last few years, there is definite realization that stress can lead to heart problems. It is difficult because we don't actually have good measures of stress. I can measure your blood pressure, I can measure your cholesterol, etc., etc. I can't measure your stress. But there are good data that stress causes heart problems. How does it do it? Well, so stress increases the risk, increases the levels of various hormones in the blood, adrenaline, cortisol. Adrenaline increases heart rate, increases blood pressure. Cortisol can lead to increased inflammation, which I've mentioned a few times. People who are stressed often make less healthy lifestyle choices. People who are depressed, for example, do the same thing. So there's very good evidence that actually more stress leads to worse health outcomes, not just cardiac, but many others as well.
And is it not just stress, but also finding ways to deal with that stress? Because, you touched on the Mediterranean diet. The research shows the longevity of people that live on the Mediterranean that have this diet. But having been there, I think, of course I'd live till I'm 90. There's no stress living here with this great weather and in this great climate. So how much of it is stress and how much of it is just finding a way to deal with the stress?
I think, I'm sure that those people living in those wonderful places in the southern Mediterranean have their own stresses.
Yeah.
Nobody has a stress-free life. And it is how you manage and deal with your stress. And again, there are, a lot of people sort of, want to go and they're hoping that they can just get a pill which will help them deal with their stress. Those pills have side effects. Generally, in my opinion, better avoid it. Clearly, there are some stressful situations that you need to just try and modify. But otherwise, I've come back to exercise again. Exercise helps you manage stress. Getting outdoors helps you manage stress. Sleep, we haven't talked about sleep. Getting a good night's sleep helps you manage stress, helps with your mental health, reduces, again, the inflammatory burden in the body. So there are lifestyle measures we can make to help manage our own stress.
Well, why do you think people underestimate the importance of sleep?
I can't remember who it was. Was it some film where somebody said sleep is for wimps? There's just
sleep when I'm dead. These are all the sayings.
Exactly. So there's just this macho attitude about who needs sleep. I can manage on 4 hours a day, and I accomplish more than other people do. It's just not true. Sleep is absolutely essential for our well-being, mental, physical well-being, cardiac well-being, and getting a good night's sleep, 7 to 8 hours a night, isn't going to affect you. It makes you less active, etc. during the day, but in the long term, repeated sleep deprivation increases the risk of dementia. Very good evidence that people who don't sleep enough are more likely to develop dementia. So getting a good night's sleep regularly is also important.
Doctor, what are some of the more common misconceptions about heart disease that you'd like to clear up? You mentioned there was obviously don't exercise if you're suffering from heart disease.
I mentioned earlier that women don't get heart disease. Women definitely can get heart disease. They need to be careful about their cardiovascular health. People, for example, who take statins, who then think that I can now eat anything because actually my cholesterol's low, I don't need to worry about what I eat. Yes, it's true that most of the cholesterol in your blood is being made by the liver, which is what statins reduce. But actually, a substantial amount of the cholesterol in your blood comes from what you eat. And so even if you are taking a statin, being careful with your diet, exercising regularly, reduces your cholesterol. Smokers who think that, well, I've been a smoker for many years, it won't make any difference if I give up. It makes a big difference. 1 year, even in heavy smokers, 1 year after giving up smoking, your risk is halved.
Wow.
10 years after giving up smoking, you have the same risk as somebody who has never been a smoker. So giving up smoking is useful, is definitely beneficial in so many ways.
And what about some of the misconceptions about alcohol when it comes to heart disease?
People have this idea, or some people have this idea, that alcohol doesn't lead to heart problems, that all these other risk factors, lifestyle measures, affect heart disease. Alcohol very definitely does. Increased alcohol increases blood pressure. Increased alcohol leads to weakness of the heart muscles. There is a condition it's even called alcohol-related cardiomyopathy, which is a weakness of the heart muscle entirely caused by alcohol excess. Alcohol excess causes heart rhythm abnormalities. So people need to be careful with their alcohol intake for cardiac reasons as well as many other health reasons.
What about vitamins and supplements?
Everybody in Dubai seems to be taking a handful of vitamins and supplements every day. Vitamins and supplements are not going to prevent people getting heart disease. They may marginally reduce the risk, but people talk about antioxidants and vitamin E and vitamin C and magnesium. There are no published studies showing that these actually make a difference. Studies have been done and they have not demonstrated benefit. So yes, take a multivitamin, but don't forget that that's not going to prevent problems occurring. And a multivitamin supplement is not a substitute for a healthy diet.
Yeah, taking a few supplements is not going to counteract a weekend of poor eating and no exercise.
No, exactly.
It's been fascinating speaking to you, Dr. Khan. And before we go, if we can look forward a little bit, what are some of the recent advancements that you've seen, certainly in heart disease, or what are the new methods of prevention or some of the latest technological advancements that you're excited about?
There are many, many. I mean, because heart disease is so common, there is a lot of research effort and funding going into investigating the causes and treatments of heart problems. And there are advancements in medication, in diagnosis, in treatments. In the last couple of years, just for example, these anti-obesity drugs, which are huge in Dubai, but they have a cardioprotective effect over and above their weight loss effect. They have been used in people post-heart attack who are not overweight, who are not obese, and shown that those people, and given these medicines, end up with reduced risk of future heart problems. There is another type of diabetic medication called an SGLT2 inhibitor, which again started off as a diabetic medication, as these anti-obesity drugs did, but is now being used because it turns out that actually it helps people with coronary disease, it helps people with heart failure, it helps people with high blood pressure. So again, this is a medicine that has now become a mainstay of heart problems. Cholesterol lowering, until a few years ago, it was statins or statins. And if people didn't get on with the statins, there wasn't really that much that was useful to lower cholesterol. We now have more oral medications. We even have injectable cholesterol-lowering medications. There is a drug called inclisiran, which only needs an injection every 6 months.
As opposed to, say, a daily tablet?
As opposed to a daily tablet. So
Wow.
2 injections a year gives you the same amount of cholesterol lowering as a daily tablet. And that's it. You don't need to worry about this daily tablet after that. It's very expensive at the moment, but the price will come down. In terms of diagnostics, so I think I mentioned cardiac CT earlier. Cardiac CT is something that has exploded in the last 10 years. As CT technology has improved, and it is continuing to improve. There are really only 2 ways of taking pictures of the blood vessels to find out if there is plaque, if there is narrowings. And there used to be just one, essentially. It used to be an invasive procedure where you actually had to put a tube inside somebody's artery and pass it all the way up to the chest.
Up through
exactly.
the
Used to be through the leg, then through the wrist, and all the way up to the heart. But actually, with improving cardiac CT technology, in most people, we can get very clear pictures of the coronary arteries using a non-invasive technique. It just involves a dye injected through a drip in the arm, if you like. And we can take pictures of the arteries and find out if there is a blockage or the severity of the blockage without having to do an invasive procedure. There are, in terms of further interventional procedures, we've been using cardiac intervention. We just talked about putting tubes up to the heart to treat blockages in the blood vessels. But the next frontier for interventional cardiology is actually treating problems with the structure of the heart, which used to be something that could only be done with open heart surgery. But we now have, it's amazing that through a 5mm incision in the groin, you can actually put a whole new heart valve in. And this is something that's being done regularly and almost routinely now in people who have heart valve problems.
It's incredible.
Yeah. It is. It is actually. I mean, the technology is amazing, and it's something that we sort of, when you're using it, you take for granted. But actually, the effort that goes into,
the years of research,
the development, the engineers, it is actually amazing.
Well, Dr. Masood Khan, first of all, congratulations on all of your success, and it has just been a pleasure listening to you here on this first episode of Heart Matters to hear your insights, obviously hear your advice, but reiterate on those key points of the balanced diet, the exercise, keeping everything in check and making sure that you are having regular checkups.
It's been a great pleasure, Lachlan. Thank you again for having me today.
My thanks once again for Dr. Masood Khan for joining us here on the very first episode of Heart Matters. I'm Lachlan Kitchen, and hopefully you've enjoyed this conversation just as much as me. A reminder, if you'd like to learn more about heart health or find out more about any of the episodes in this series, you can visit our website, golfnews.com/podcasts/heart-matters. And don't forget to click and subscribe so that you never miss a future episode of the series Heart Matters. Thank you very much once again for joining us, and I look forward to your company next time on the next episode of the Golf News vodcast series Heart Matters.